Hello. So our product is called the Virtual Health Card, and the tagline came up with was Know Your Health.
What problem did we notice? We identified that in our community, most people don't have access to health records in their past. These health records that we have today are on paper. This means that they can be easily lost and they're not easy to access. Our opportunity. What's the solution for this? We thought that if we make these records digital, A, they'll be easy to access for everyone, no matter which doctor they go to, as long as they have our app, and B, they won't be lost anymore. So we identified three main customer segments: working women who care about their health, doctors who work at hospitals and need access to their customers' healthcare, and parents with the children below 18 years because they want the child to have access to the healthcare always.
So our first customer archetype is the woman who's 18 to 65 years old. We would hope for her to earn near 4 lakhs a year so she could be in the category to afford our product, and we'd like her to be really social and hardworking. Our second customer archetype is a stay-at-home parent who takes the primary care of the child and is very health conscious and tech savvy, and we like the family to make around 8 lakhs a year. And our third and last customer archetype is the doctor who will be providing a system to be able to input health records in so we could make sure our product is as up to date as possible with real time.
So for our customer discovery, we interviewed a range of people considering our market segment, and we inferred that from a market survey that 78% of the people do not have their health records in one place, like in an organized manner. And we further inquired that 92% of the people would be willing to pay for this product. And when we asked our main customer archetype, which were parents, that they said they would not only pay for their child but for themselves as well. And as our product is virtual on a smartphone, like all our customers need to own a smartphone, and we inquired that like all the people who we interviewed, all of them were using smartphones.
Based on our customer segments, the market sizing for the parents is we have a few criteria. So like they will have children under the ages of 18. Their family income should be above 2.5 lakhs. They should be, so after targeting 25% of these people, we will be having 85,500 people. So based on our second market sizing, people who are living on their own, especially women, between the ages of 18 and 65, living in Mumbai and having an income above 2.5 lakhs again. So after we target 10% of this market, we'll be having 216,000 people in Mumbai. And the third customer segment, which is the doctors, the market sizing is 35% of the total doctors living in Mumbai, which makes 455 doctors. So through these doctors, we'll be able to access around 768,040 people. So using the average number of patients a doctor attends.
So our first competitor is iCure. So these are the physical cards of it. So it is a West Bengal based company, and it is a large company, but the health card sector of it is small. And in our company, our health card sector is the main sector. And these iCure are mainly based on the poor people, and they give health cards to the people living in rural areas, whereas we are concentrating firstly on the people living in urban areas.
So our second competitor is SGRH, which is Sir Gangaram Hospital. They use a physical health card, and like the reason why we're better than them is that we have it digitalized on a phone, on customer smartphones, and as our world is getting digitalized, our product would be more viable in the future.
So you can see on this graph where we are and where our competitors are. And as a group, we realized that our app is more costly than others, but this is because we aren't willing to compromise on the quality that we offer to our customers.
So the main strengths of our company is that it's easily accessed to markets, as everyone uses smartphones. It's digital, so the health records will be more organized and accessible. Then opportunities we discussed, people do not have their health records in one place in organized manner. Then few of our weaknesses that like people may perceive our subscription as costly, and the data collection can be a slow process.
So when you open the app, this is the login page. You have to write your username and password every time. So this is the home page, and if you click on the medical ID, this is the medical ID which has a unique QR code and a unique identity number.
The upload button would allow users to take pictures of their past or current health records and upload it in the app. The people who are working for us in the service center will segregate our data. Okay, so to quickly summarize our 4 Ps, our product is a digital health card which stores all our health records. The cards are secured by the cloud. Platform. We're using penetration pricing strategy as our price to obtain a larger customer base, and for our place, people would be able to access our app through a website or an app.
So we'll be promoting our product through hospitals, stalls in hospitals and hoardings.
And we're going to be securing it through a cloud platform because with all these customers' data, they need to be secure. And so our next steps after that are we're going to start implementing it in hospitals. We are going to try to get up to 8% of our market. Okay. So what we're going to need is going to be around our pre-launch cost is going to be around 18 million rupees. So we're going to need around maybe 40 or like 30 crores to be able to get our startup costs, hiring our employees, be able to create our platform, obtain the right security, and make sure that all the stuff is secure.
I think it's a very important need that is there, which you've identified. In the end, it's about getting people to actually do the job. It's very much like, say, you need to clean your room, but it's always dirty. So how do you make people convert and on top of that pay money to do that?
So we actually, according to our financial plan, for the first 6 months that you download our app, you get it for free. So this is off your cost. And if you choose that you like our app and you like the services that we're providing, then you start paying for the app, but that's only after a free trial period of 6 months.
Physically scan and upload the documents, scan them and put it up? Or
So
how does it,
if
because I go to a doctor, he gives me a prescription or he gives me a report, right?
So you can either do that yourself if there's a previous health record that you want to upload. But if you're going for a doctor's appointment, that's for what the scanning bar is in our MVP. So through that scanning bar, the doctor can upload
Directly.
to the QR code.
One other interesting thing you could have, would you consider is when you have doctors, if you charge for a premium service, you can upload your reports, and a doctor virtually can go through it and give you through a chat box, because everybody gets reports. Then your doctor's appointments are 1 week, 2 weeks later. Everybody is nervous what's happening. So you have a way wherein the doctor can communicate with you online.
So how much do you pay for the app? Like what's the premium price?
The price after the 6 months,
Yeah.
it's 300 per month.
And out of all the target segments that you chose, women, doctors, and parents, who do you think would go for it first?
Parents, because you want your child to have the best healthcare possible.
What if we manage to get all the doctors to go digital? Is that possible?
So it's hard to get all of the doctors to go digital, but we're trying to target I forgot the exact number, around 400 doctors, so they can recommend to their patients. They're like advocates for us. We're trying to make them be. So then before maybe a child is born, you could recommend to the parents, and then they would be like, oh, maybe this is a good idea to be able to see the health records from birth until however old they get.
So you're collecting a lot of information, right?
Yeah.
What do you plan to do with that information?
So
You're collecting a patient's every information, like from zero to, so what do you do with that information? Do you use it? Do you give it to doctors for chatting, for prescription, or what?
So we are not using it for anything for us. What we do is we make it so the doctors can see it as well as the patient can see it. And so we're doing it so the patient can see the records whenever they want, in case like some schools ask for health records, you can just like, you don't have to go call your doctor, make them give it to you. You can just do it directly, so it's going to save a lot of time.
One important way to get quick downloads, every patient listens to his doctor, most patients do, is to incentivize the hospital or the doctor to say, if I get 300, every user, you incentivize them by saying, I'll give you 10% or 5% of my subscription as a referral fee to you, so that there's ease of, helps you get downloads quickly, and the doctors can then online see their patients' records and all that stuff. So that'll help volume.
I agree. I think that's a very good point, because I think the doctors could save a lot of money on their own internal cost on this as well. Good job. Thank you.